Ms. Hodge, what is a lactation consultant?
A lactation consultant is a professional who is versed in the treatment and management of breastfeeding problems, and also one who teaches moms and professionals about breastfeeding in its entirety.
So you're saying that sometimes doctors have to be educated too, is that true?
That's correct.
Mummies probably who care about their child will look into all the avenues. We hope they come to the conclusion that breastfeeding is best. Is that correct?
That's correct.
Okay, and I've heard you say many times, if Mother Nature makes it, it's probably the right thing to do. Is that correct?
That's correct.
Okay, and some of the advantages we could say is, one, it saves you a couple of $1,000s that first year. And I heard you say a couple of times, that husband should buy you a beautiful present. Something shiny, is that true?
Yes, what I say to moms, the money that they save if they buy breast milk substitutes, it can save them a pretty penny, and they can always get that shining diamond necklace that they wanted.
But general rule, if you looked at a baby that was breastfed, there's something about the glow of the skin. They seem to be a little bit brighter. Is that true?
Oh yeah, you can tell breastfed babies. They look chunky, but they are never overweight babies. There's a rarity where you may find some babies that are overweight, but in general, they look chunky, babies that you want to just eat up. We call their thighs thunder thighs because they're nice and chunky looking.
There's some indication, of course, the jury's out a little bit, that breastfed babies probably end up a little bit higher IQ.
There have been studies to that effect, but there are more things that are involved with IQ measurement.
Some people think it's, if the mother has a very strict diet against allergies, it might be even less allergic. We don't know if that's true. And then less apt to get sick because there is some immunity passed on from the breast milk to the baby. So less diarrheas, less colds the first year.
That's correct. Most moms do pass on immunity to their babies, and that lessens the chances of infections. We know what studies have shown that ear infections are lessened, and as a pediatrician, I'm sure you can attest to that.
And also less diarrhea.
That's correct, and especially in third world countries where diarrhea is a big problem, breastfed babies do benefit.
We also found out, not even from a pediatrician, that if a baby is born of a premature situation, the breast milk is actually better for a premature because it's richer and thicker in some different chemicals, and now the drug companies have made formulas to match it a little bit. Is that correct?
We have seen that, but we do know for sure that scientifically premature babies' mom's milk is better, and there are ways that you can really get these babies to get higher calorie by pumping and feeding them the formula from the mom. That's of great benefit to the preterm baby.
The first and most common question about a new mother breastfeeding, how will the baby know what to do? And yet they do, is that correct?
Well, babies are instinctively wise, we know that. And studies have shown there's one footage that I've seen where a baby was put onto the mom's abdomen after birth, and then that baby crawled right up and found itself and latched on to the mom's teeth. So that's something really wonderful. We can see instinctively it's there. Babies.